8 in 10 Australians view mental health as an important guide to their election vote. But Mental Health Australia, the peak body representing mental health organisations across the country, says current promises don't go near enough to solving the crisis. Joining me now live is Mental Health Australia's CEO, Leanne Beagley. Leanne, thanks for joining us. The organisation has commissioned an Ipsos survey of 1,000 Australians. How important is the issue of mental health to voters?
Well, we were very interested, thank you for having us, very interested in the fact that 82% of the respondents to the survey talked about how important mental health and wellbeing and the services related to mental health were to them in thinking about the election and their voting. And what was even more interesting was that 29% of them said they would change their vote if one of the political parties outlined an extensive system reform plan that had a vision for the future, and that they would actually change their vote to support that party.
I think that that's a fascinating statistic. That's nearly 1 in 3 voters who've said that they would consider changing their vote. Have either parties, in your view, actually produced a comprehensive plan for reform this election?
No, that neither of them have. So what we've had is as a set of commitments that both parties committed to in different ways. They've talked about the cost of living and the impact on people's lives. They've talked about improving the access to medicines and the cost of medicines. They've both said they're committed to the NDIS and Medicare. They're both interested in actions related to better access to for people in rural settings to access mental health care. The coalition's talked about some new perinatal support centres for new mums and dads across the country. They've talked about some First Nations partnerships around social and emotional wellbeing to tackle high levels of suicide in those communities. Labor's talked about aged care, more staff, more time with people, and more support in aged care. And they've also talked about primary care, urgent care clinics, which would create a front line for mental health response. But really what we haven't seen is a system vision. It's like pieces of a jigsaw without the big picture, so you don't know how it all fits together. And there has been a blueprint that the Morrison government announced in 2020 a Productivity Commission report that called for billions of dollars of investment and laid out a map for how to do that. They called for an increase in government expenditure of $2.4 billion per year to offset the fact that in this country we're losing $70 billion a year in productivity and economic impact by not addressing mental ill health. So we haven't seen a vision, a comprehensive vision for responding to that. We haven't seen a comprehensive vision for responding to COVID and the long impact that we expect this will have in different parts of the community, not just economic, but the long impact for individuals of the lockdowns, the social isolation and the challenges that COVID recovery, it's not over, and that COVID recovery has brought. So we called for a 25% reduction in suicides and to set a target so that we work together to galvanise the community and all the governments on reducing what is really a staggering suicide rate in this country. Every 2.5 hours an Australian dies by suicide and others attempt their lives, and it's of course the leading cause of death for Australians between 15 and 44. So we called for both parties to commit to a reduction and to work together with accountability and a set of activities to reduce that suicide rate, and neither has committed to that.
You mentioned how much mental health is costing the country every year. How does that compare with the money that's actually currently being spent to address it?
Oh, there's no doubt. Thanks for that question. There's no doubt there's been comprehensive expenditure, particularly in responding to the crises, both the fires and floods and also the COVID. There was a pandemic mental health response plan, and great credit to the government for responding. But in those instances, they were building on a system that was already broken, which is why they quite appropriately asked the Productivity Commission to investigate options for responding. And so, what's really important here is that there was an original investment by this government of $2.3 billion in the budget in 2021, but we haven't seen that increased over the time, nor a commitment to doing so. So there's been some local announcements for local services in states or in particular electorates, but we haven't seen that comprehensive plan that we need to see that will respond to people both who are at the beginnings of their challenges in mental health and those who are really seriously unwell and for whom things like housing, cost of living, the NDIS and challenges about employment and the economy have a really big impact.
It's such an important topic to speak about. Leanne Beagley, we have to leave it there. Thank you very much for joining us.
Thank you so much.
And if you or anyone you know is feeling distressed, you can call Lifeline on 13 11 14 or visit lifeline.org.au for more support.